the Gauteng Health Department has confirmed that the death toll from a cholera outbreak in Hammanskraal has now climbed to 10. Provincial MEC Nomantu Nkomo-Ralehoko says 95 people have been treated for diarrhea, nausea and stomach cramps in the past week. This has been described as a gastrointestinal infection outbreak in Hammanskraal. 37 patients are currently receiving treatment in hospitals in Tshwane, and their condition has been described as critical. Let's bring in the MEC now. Nomantu Nkomo-Ralehoko joins us via our video link this morning. MEC, good to talk to you. Good to get an update on what is a harrowing story in Hammanskraal. Can you give us the latest numbers in terms of infections, and hopefully that number insofar as deaths has not increased even further?
In fact, the number on death has increased with 2 now that were optimized. But still, yesterday, I think it's only 3 out of the 95 that came in when we left at 9 o'clock in the evening. So I'm expecting then an outdated report now in the morning, because at 7 o'clock, the new shift is getting in, so they will be handing over the report of what happened in the evening up to until this morning. But indeed, it's 90, now out of 95, it's 97 that is there, that has been treated. But we've taken 22, in fact, we distributed 20 between Dr. George Mokari Hospital and Steve Biko. So we've eased up that pressure, but still have the 37 that we had to put in at Jubilee Hospital. We've activated 2 wards at Jubilee Hospital now that are responsible for the cases that we are receiving. But again, I'm going back there in the morning with other colleagues from government that are working with us at the municipality and at the national government. They will be there, especially the minister, the deputy ministers for water and sanitation. They will be there so that they can see, because we want to do as they have been doing the thorough testing on the waters, but even the environmental teams have been on site to try and assist us and check what is it that is causing of this. Because almost 90% comes from Kanana area on the people that have been admitted and that have been seen. Surman and Majaneng, Greenfields and Skampaneng and Lippingville, including Carousel View. But what we've been doing is to send the community health workers and other teams, environmental teams, to these areas that we have identified because of the number of people that are coming from them. So we're doing education from those communities in terms of cholera outbreak that is there, and try to make sure that they clean their areas, they wash their hands, all those important necessary things that they should be doing to prevent it.
Sorry, MEC, I think I was unclear on the death toll so far. What is the number as of this morning?
It's 12. The number is 12 now. We have additional 2 that left us.
12 people have now died of this cholera outbreak. So, MEC, how, according to your understanding, how did this happen?
We suspect the cases of water and the cases of the environment in the area, because cholera comes from those areas that there is a problem of water, or where if people are not washing their hands thoroughly. So I think that's what we should be, what we are doing now in terms of the precautionary measures of hygiene measures that we want them to maintain in the area. It's washing of their hands, is making sure that if they drink water, they don't drink tap water in Hammanskraal. And part of the interviews that we've done to the patients in the hospital, they said they drink water from the tap. And we know that Hammanskraal water has not been good at all. So hence we're saying now, if you want to drink water from the tap, boil that water, put a little bit of salt, wash your hands, use clean water when you are cooking. So, and we have asked the municipality, because that's what they've done, because they've been there. They've delivered the water now with the trucks, because they've been delivered water with the trucks in all the various wards and the community of Hammanskraal, so that they don't use any of that water in the taps.
I mean, MEC, what you're requesting this community to do, what you as government are requesting this community to do, to boil water before drinking it, to not trust tap water. I mean, this is already an impoverished community. How do you expect them to have the resources to then have to boil water when they struggle to have the resources to cook their food?
You remember in the olden days, in fact, coming from the rural areas, you boil water outside with your 3-legged pot. And we expect the community, because we've been doing these educational programs to the community. And that water, you only boil it at least for 1 minute. You make it sure that it's an effective way of drinking this safe water. And even then, we were told, because we were taking water from the rivers, from the streams, river streams, and we were told that when you drink that water during those olden days, which we expect it now, because we've been doing these educational programs around the area of Hammanskraal, and we say put 1 teaspoon of household bleach in 25 liters of water. It's something that we grew up knowing. And hence we feel that it's not a difficult thing to do, and put 2 drops of household bleach in that water. Wait for 30 minutes before you use it, because you let it cool and then it becomes cold. Even myself, I drink cold water or boiled water, even in my place now. Besides that, I can't compare myself with them, as we are saying, which we are correct. And we always say, store your treated water in a clean and covered container. So you boil it, you let it cool, and then you put it in your covered container, so that the children, including yourselves, you can use it. And we're saying again, if you are using the bathrooms or your pollution block or sanitation facilities, they must be safely managed, and get rid of feces if you find it there, so that you can try and clean your seat if you are going there. And we're saying again, pop up at least 30 minutes away from anybody, so you don't always come we're saying again, dispose of plastic bags. You remember, once we have an illegal dumping in an area, there are a lot of latrines that you will find there. So the dustbins must be collected again, because once there is some dirty places there, definitely there are high chances of having cholera in a place. But all these things can only be done if we are ourselves making sure that we educate our communities. And we're saying again, cook food well. Don't just cook food not well. So those are the things that we have written, even in the pamphlets that we're distributing. If you want to eat something, try to peel it if it's an apple, because the conditions that we are now in that area need us to tell them to do that, whether it will be difficult conditions, but we want to appeal to the communities. If you are cooking vegetables, wash those vegetables before you can even cut them and cook them. So, for example, your spinach and your cabbage. Sorry,
MEC, can I just come in there? Because what you're describing, the advice you're giving residents is absurd. For them to have to boil water, to add bleach, to add whatever else it is that you're saying, in a context where residents in Hammanskraal have been struggling to access clean running water for almost 20 years, this cannot be the advice from government. The Water and Sanitation Department is going there today in a reactive move. There's nothing proactive about what government has done in Hammanskraal. Do you accept responsibility for this cholera outbreak?
No, I don't think it's a reactive mood. Hold on there. It's not a reactive mood. We have been working in Hammanskraal for all these months. I know even previously government have been working in Hammanskraal. The issue of the water in Hammanskraal was long been identified, and the municipality must take responsibility of ensuring that that is being sorted, because the issue of water is not the issue of the Department of Health. I'm coming there on help because now my hospitals are full of people that are not well, and hence now it's me that is in the forefront of this issue. But it's not that government never did anything. Something was done there. You know, ministers have been going there. Deputy ministers have been going to Hammanskraal to try and sort out this problem with the municipality. Hence, MMC have been there since Friday, because they know exactly what they should have done to correct the situation in Hammanskraal.
So what has been done, MEC?
But I think what you must do, call the municipality and ask what they've done. Ask me about the issues on health. What have I done to make sure that we're treating the people in the hospital? And I'm telling you what we have done, that we've eased up the pressure and taken patients to the other hospitals to get assistance. We've brought more nurses that must be on site to treat the patients so that they don't wait long. We've activated 2 wards that some of those patients must be in those wards so that we treat them with decency. That's what I'm doing in my hospital, where I am at Jubilee Hospital.
Right. But arguably they should never have landed up in hospital with cholera, right? That's the point.
That's why I'm saying there have been preventative measures on our side that we've been doing. But that question directly to the municipality. On my side, I've community health workers that are moving in the communities on daily basis. That's the preventative measure that I'm doing. And not only in Hammanskraal, you know, I've been having educational programs all over the province for the past 6 months since I've been in the province, on daily basis, telling them on the do's and don'ts, even teaching them how to wash their water. I was even going to the shops in the communities, all those plaza shops. We are checking them on the food control. As we speak, I'm going to another area called Mansfield this morning to do the same program. It's not that I'm reacting on my side. So the municipality, maybe it's reacting, I will not protect them. And on my side, it's not a reaction. It's a preventative that I've been pushing in the department since I've been deployed in that department.
Well, at 7:15, we're in conversation with the MMC for utilities. So we'll definitely be getting the perspective of the municipality. The point, MEC, is that, and you're a representative of government, right? Yes, you speak on behalf of health, but you're part of government in Gauteng, right? And so you shouldn't be going on road shows to try and tell people how to clean their water with bleach, right? That's not what you should be doing, surely, MMC.
That's what you are doing, surely. I mean, I'm going to forward you my programs. You will see from day one that's what I've been doing. In fact, even on social media, other people doesn't understand this role of prevention. They were asking me, what are you doing in these communities? I'm doing these preventative measures because I know that once I do that, I'll ease up the pressure from the hospitals. So I will not stop doing that. And this is my government, you are correct. And I work with the municipalities. I don't go to those communities alone. I always bring them along so that they must do what they are expected to do in the communities, which is local communities that they are supposed to service, by the way, together with all of us that are in government. So you are correct in that. And I'm happy because MMC joined us yesterday afternoon of utilities in Tshwane, because we called them, we said they must come. They must go down with us to these communities because solely it's their responsibility, the issue of water in that municipality. And they know that. It's not like we're accusing anyone here. Everyone knows his or her responsibility. But that's why I'm coming on my side with my responsibility.
MEC, pardon me, the question I'm asking is, you shouldn't be, as health MEC for Gauteng, educating people on how to bleach their water. For you, as health, that should not be part of your portfolio,
you're wrong. You're wrong. Go and check my work. My responsibility is to ensure that I prevent people from getting sick. And that's what I should do. So I can't do it anywhere else except to the communities. But I can be joined by my colleagues. Hence, when I go to the communities, I tell my colleagues in the local municipalities that I am there. Come and do your part. I'm doing my part. That's my work. Even injecting people, advising them to come to the stalls. In fact, we have mobile unit clinics that are going around in every community. Where I'm there, I'm even treating them on site. I have doctors, I have nurses that I go with them in every area that I go. So that's my role as an MEC for health. Because my hospitals are full, my clinics are full, I must prevent those diseases. It's me that deals with the disease control, by the way.
The point I'm trying to make, MEC, is that we should have clean running water. After 16 years of residents complaining of not being able to trust the water in their taps.
I totally agree with you. I don't dispute that. I totally agree with you. And I'm saying, what are the measures when people don't have that clean running water that is coming from their taps? Municipality must take responsibility. Provincial government must assist in educating those communities so that they don't feel victims of that. Trucks must deliver water in those communities. And that's what's happening now as we speak. And it has been happening. But I don't know what went wrong. I don't know why people, because they should have told them that this water is still not right to be used.
Gauteng Health MEC Nomantu Nkomo-Ralehoko, let me thank you for your time this morning. The latest update on the story of the cholera outbreak in Hammanskraal is that the death toll has now risen to 12 people having died as a result of this cholera outbreak. A number of people are still in a critical condition in hospital. As I just mentioned to the MEC there, the city of Tshwane has urged communities in Hammanskraal and surrounding areas not to drink the tap water.